the newest beauty procedure taking over Southern California. It's so fast, Shali. How fast is it?
Oh, how fast?
You can during your lunch hour.
How about a liquid nose job? Heather Lake is in Solano Beach to explain what you want to do.
Is that like when you're drinking Coke and somebody makes you laugh and like...
No, that's not it at all. I'm going to explain this. Okay, liquid nose job. If I didn't get your attention this morning, well, then I don't know what will, right? But actually, Monica did get this procedure done on her lunch break. Dr. Melanie Palm with Art of Skin. We're going to go ahead and show off what you have done here. We've got some images to show befores and afters. The pictures that are showing up on your screen right now, the before is on their left side, right? And then right side is the after. This is the non-surgical. Don't go under the knife. But if you just have a little bump or something on your nose, the ridge that's bothering you possibly for years, this can help smooth that out.
Absolutely. So sometimes even post-rhinoplasty patients, I think if you go to a lot of rhinoplasty experts, if there's a little just irregularity after surgery, this is something we use to smooth things over. Or if patients don't want to go under the knife, maybe they can't go under general anesthesia, this is such a lovely thing that can make a huge difference. People truly look like they've gotten a nose job if you select the right candidate.
Okay, so this is what we've done to her. So if you go to the side, we can see that she has a little bitty bump right there. And what did you do? We can mark up where you marked her.
So, you know, often patients have something called a dorsal hump, or a little bit of an area that's prominent right here along the dorsum. So what we do on typical patients is we fill a little bit here just before, kind of close to what we call the nasal root, just before the hump, and a little bit afterwards. In women, we get something called a super tip break. So there's often a little bit of a dip here, so I don't want to take that away. That's part of what makes a feminine nose. But many people also have a little bit of nasal droop, meaning that their nasal tip is actually coming down. So we can actually fortify that by putting a little bit at the base and a little bit in this area that we call the columella.
So you're using fillers. We've got to go back to the studio, but we're going to show off what and I want everyone to see the needle, because I think people are scared of needles. We're not going to, give needles this morning, but you're using the normal fillers that people have been using in their face, and this little guy right here.
It's actually an insulin syringe needle, super small, 31 gauge. So this is what diabetic patients actually use, but super tiny amounts. You want to go to an expert because it is a little bit of a risky procedure, but in the right hands, very gratifying.
Okay, we'll be talking about this a little bit more in the next hour. I know we have to wrap it up for now. Shali, Raul, I'm sure people are super curious, so maybe we'll do a Facebook Live and answer some more questions.
You should do that, because I'm sure a lot of people want to know a lot of